Hi everyone, thank you for listening in today. I'd like to acknowledge the Public Health Agency of Canada and the Canadian Society for Exercise Physiology for their support of this work and the guideline launch. My name is Jennifer Tomasoni, and I am a faculty member in Kinesiology and Health Studies at Queen's University. I was the Knowledge Translation Lead for the 24-hour movement guidelines for adults. Our knowledge translation team conducted a systematic scoping review to help inform the strategies we would use to promote the guidelines. While I led this review, I would like to acknowledge the contributions of my co-authors, without whom this complex review would not have been possible. The three biggest take-home messages of the review are, first, dissemination strategies may be useful for increasing awareness and knowledge of movement guidelines, but these have rarely been evaluated. Second, implementation strategies are needed to move beyond awareness and knowledge of the guidelines to increasing people's intentions and behavior in line with guideline recommendations. And third, engaging stakeholders and members of the general public in the development of knowledge translation or KT strategies for movement guidelines will increase strategy feasibility and impact. The presence of a movement guideline does not guarantee that people will be aware of it and follow its recommendations. Two types of strategies are needed to see these outcomes. Dissemination strategies aim to support the distribution of a guideline, while implementation strategies aim to support the general public in meeting guideline recommendations. Little is known about how to disseminate and implement national-level guidelines that integrate multiple behaviors, such as Canada's 24-hour movement guidelines. In addition, a synthesis of strategies used for physical activity, sedentary behavior, and sleep guidelines had not yet been conducted. As such, our objective was to identify strategies for dissemination and implementation of national physical activity, sedentary behavior, and/or sleep guidelines that were targeted towards community-dwelling adults or stakeholders in Canada and similar countries. Stakeholders, such as policymakers and health professionals, were included because they can influence the movement behavior of adults. As different strategies are required for guideline dissemination and implementation, specific research questions were formulated for each process. We wanted to know which strategies have been used, how the strategies were evaluated, and which strategies were reported to be effective. Because reports of dissemination and implementation strategies are rarely found in peer-reviewed venues, we drew on systematic scoping review methodology. First, we identified eligible national-level guidelines, and 15 were included. Next, we searched for records that reported dissemination and/or implementation of one of those guidelines. Peer-reviewed and gray literature databases, as well as custom Google search engines were used. We also searched organizational websites and consulted with individuals representing organizations who had developed, disseminated, and/or implemented one of the included guidelines. Data was screened, charted, collated, summarized, and reported following established protocols. Strategies were classified by strategy type using a modified KT taxonomy. Finally, risk of bias assessments were conducted for all reports that included an evaluation of a strategy. 47 records were included in the review. I'll walk through 3 of the key findings, with further findings and details available in the publication. The first key finding was that dissemination strategies were more frequently reported than implementation strategies. However, dissemination strategies were rarely evaluated. Examples of dissemination strategies that were reported included distributing guideline materials, such as scientific guideline documents and public-facing materials. We noted mass media and communication campaigns, which included widespread purposeful distribution of information to the population via existing media, as well as education, or the teaching about the benefits of complying with a guideline from a credible trained person, such as a CSEP-qualified exercise professional. A novel strategy identified was the creation and sharing of a dissemination toolkit which provided social media messages, graphics, newsletters, and videos to promote a guideline to members of the general public and stakeholders. For the few dissemination strategies that were evaluated, the largest impact reported was increased awareness and knowledge of the guideline. Thus, if we want to change movement behavior levels, we should move beyond dissemination to also consider implementation strategies. While implementation strategies were identified less frequently, they were more likely to be evaluated and associated with positive changes in movement behavior levels. Examples of effective implementation strategies included enhancing human resources, meaning increasing the number of staff or changing staff qualifications to facilitate guideline implementation. For example, adding a CSEP qualified exercise professional to a person's healthcare team. Providing feedback about an individual's current adherence to a guideline was commonly associated with positive outcomes, as was counseling about movement behaviors and the use of planning tools. Note that several implementation strategies were often combined in a single intervention, making it hard to delineate the individual impact of a given strategy. Because these implementation strategies can be challenging to execute, this points to the importance of the third key finding. Formative research and partnership development are required to enhance the impact of dissemination and implementation efforts. Including these aspects as part of the strategy development process was linked to more feasible strategies that were better able to meet the needs of the target audiences. In addition, the greater the scope of partnerships and level of engagement among partners, the larger the network size and capacity for strategy execution, and the more likely that national level dissemination and/or implementation of the guideline could occur. The 24-hour movement guideline knowledge translation team applied the findings from this review when developing our dissemination strategies. We conducted formative research and engaged both stakeholders and members of the general public when identifying optimal messaging strategies. We have produced and distributed both scientific and public-facing guideline materials. In partnership with Participaction, we have also produced a dissemination or communications toolkit for our partners and really anyone to use to help spread awareness and knowledge of the new guidelines. The guideline materials and the toolkit are available on both the CSEP and Participaction websites. Our team is still working on the implementation strategies that we will use, but we will turn to these review findings when developing our strategies. A main implication for public health stemming from this review is that we cannot expect population-level changes in movement behaviors if we do not plan and mobilize implementation strategies to complement the widespread use of dissemination strategies. The importance of engaging guideline end users in these guideline knowledge translation efforts should not be underscored. And finally, for those involved with guideline promotion, we also hope that the review findings highlight the importance of documenting and evaluating movement guideline dissemination and implementation efforts, as doing so will advance both practice and science in the field. Thank you for listening.